Welcome to the For You Fitness podcast. We're back with Integrative Physician Dr. Deepa Verma for another awesome two-part episode. Dr. Verma joins me today and discusses the symptoms of inflammation, how it plays a role in our gut health, and simple tips to help control inflammation.
When it comes to the word inflammation, can you explain what that is? And because it's a very hot topic now, and so let's shed some light on how this kind of impacts us.
So inflammation, in a very general and simple term, is just it's when the body is exposed to some irritant and it starts this immune cascade where it releases all these type of cells, things like bradykinin and histamine. You're probably familiar with histamine because we take antihistamines.
Right.
And this is what causes the inflammatory process, which would be redness, heat, swelling. So what happens is the body naturally likes to heal itself. However, if something is in the body that's not meant to be there, the body will start attacking it. And that's its own way to basically repair itself and to ward off something that shouldn't be there.
Okay, so is there such thing as like chronic versus acute inflammation, like good and bad inflammation?
I mean, inflammation is never a good thing, but the acute and chronic is definitely something. So acute is it's happening at that moment, it's immediate. Okay. So for example, you get a bee sting, right? You're going to immediately start swelling. You know, you might sometimes, if it's very severe, go into anaphylactic shock, you know, where you need an EpiPen. Chronic is where it occurs over days and weeks and years, and this is what happens to most people. So I think chronic inflammation is really what we're concerned about, because this is what we're seeing in the obesity epidemic, things like cardiovascular, metabolic disease, diabetes, leaky gut, hormonal imbalance. That's chronic stuff. Acute happens right away. I'm going to take a medication, maybe like the antihistamine. It'll go away.
Okay, so it's a body's response to something.
It's the innate response.
Okay. Now, this chronic inflammation, let's tackle the gut.
Yes.
Okay, so how does this impact, like you said, leaky gut?
So the gut starts in your mouth and it ends with the rectum, and it's supposed to be one hollow impermeable tube. What happens with leaky gut is because we're exposed to all these toxins. Again, toxins are going to create inflammation. It can be processed food, it can be toxins, it can be things we put on our skin. Especially for women, we have to think about our skincare, our makeup, our shampoos, and men too. I mean, what I'm seeing as an anti-aging MD is more men getting into the aesthetics. So it's really for everyone. Even starting as a baby, we put baby lotion, we use soap and all that kind of stuff. There are a lot of chemicals in there. So anything that gets into the body, so that triggers an inflammatory reaction. And over time, what happens is the seal in the gut, which is basically these villi, which are these finger-like projections. So if you put your fingers together, see how there's no space between my fingers? But as you have leaky gut, you start pulling it apart. Things go in and out. What is supposed to stay in the gut and be excreted will now leak back into the body, creating inflammation. And then what's supposed to stay in the body leaks out into the gut, and then we lose it. The body naturally has to excrete things. We do it through bowel movements, urine, sweat. But we shouldn't be losing vital nutrients, minerals, antioxidants. That's what happens in leaky gut.
Interesting.
And there's inflammation too. There's gut. So when I do gut health testing, I check for leaky gut, I check for inflammation, I check for dysbiosis, which is an imbalance in the bacterial flora, because we have trillions of bacterial flora. So we always say all disease begins in the gut.
Yes, absolutely. Now, are there signs and symptoms of knowing like you truly have leaky gut? Because I know a lot of people go through their daily living and they are like, oh, my stomach's upset, but that's normal. Like they kind of just like brush it off to the side. Like, can you explain that a little bit?
So when we think about leaky gut, we automatically think it's going to be something with the GI tract, something that is the gut. So people often associate it with maybe like reflux, maybe cramping, bloating, flatulence, but it goes way beyond that. So what I educate my patients on is if you have anything that you just feel off, headaches, mood swings, rashes, eczema, psoriasis, and we get all into the autoimmune stuff, that's going to be something with the gut. Like I said, everything really kind of begins in the gut. And when we're eating, we have to think of our food as medicine or our poison. That's really where it starts.
All right, since you just brought up that word autoimmune, what is this in kind of a nutshell?
So we'll break it down. And so auto is kind of inflicted upon itself, immune, right? So autoimmune means you're attacking your own body cells. It doesn't have any recognition anymore. Your body can't distinguish between what is foreign and really what is going on inside of you. So your body is basically attacking its own cells. And there are a group of diseases that people can associate with autoimmune, typically things like lupus, Hashimoto's, Graves, scleroderma, Sjogren's, rheumatoid arthritis. So all those things are people are developing their own autoantibodies to that. And it can be triggers like gluten, for example, which is now toxic, even though it's a vital part of wheat. It's, you know, wheat's an ancient crop. Why all of a sudden in the past, 5-10 years has gluten become an issue? Because it's this pesticides and the Roundup that we spray. So it's changing at the molecular level. Glyphosates, that's a huge thing. So I do all that type of testing.
So going back into different types of autoimmune diseases, I know when I'm meeting with clients and they start talking about, I have Hashimoto's, I have issues with my metabolism, like all of this stems from inflammation?
Yes. A lot of it, there's genetic parts of it too. But what I'm seeing a lot of now is just this non-specific autoimmune where the markers are just elevated, but the patient can't recount if anything's happened in their family. Typically, I'll have the other subset where people are like, oh yeah, my mom had rheumatoid, or someone had fibromyalgia, or Crohn's disease. All right, fine, there's a genetic component. But really what I'm seeing nowadays is just these things coming out of nowhere.
Great. 75% of my new clients coming in, they're talking about these autoimmune diseases, and it's scary because number one, they don't know that it could be curable, and if it is, how can we do that naturally? So what are the first things that you would tell a patient protocol-wise start with?
There's so much literature out there, and people come to me and they tell me, oh my gosh, I've read on the AIP, which is the autoimmune protocol. You know, like, what should I heard beans are bad. I heard they're good. I'm going to still eat meat. It always starts with your food. Like I said, food's your medicine or it is your poison. So you have to really pick your poison or pick your medicine, right? So I really start off with saying, try to eat as clean as you can. We live in a very toxic world, and it's going to be very hard, even if people are a little more plant-based, organic or not organic. There's toxins everywhere. Unfortunately, there's no true FDA regulation on a lot of things that we're seeing in the medicine that I practice, such as like nutraceuticals. So as long as we remove the inflammatory things, right? Things like meat, dairy, those are known triggers, and I do a lot of food sensitivity testing to show people, look, this is what's going on.
Exactly.
Oh my gosh, now I know why I wake up with a headache, why I might have brain fog. So I always start with food. Then I talk to people next about products that they're using. Cleaners that they're using. Does your house lawn get sprayed with pesticide or the fertilizers? Is there mold? A lot of people are doing mold testing. These are occult things that people don't think about because it's not so obvious. So look in your bathroom, look at your shampoos. The same kind of ingredients are used in industrial cleaners. Is that something you really want to put on yourself or your children or your babies? So remember, your skin is your largest organ, right? And so everything you put in absorbs it. Oral is actually the least effective way to get things in the body because it has to go through the gut. That's why I do a lot of IV therapy and injections. And then when we're doing medications, topical, sublingual, injections, IV are the quickest and most effective way because you're bypassing the gut. So.
Okay, now going back to, I guess, our environment, if you're in your home, even looking at, I guess you could say, your air ventilation and those plugins in the wall.
That's a great point, Nina. Yes, but those air fresheners. Car fresheners, those are so toxic. Essential oils that people use right now. It's such a big thing, like, oh, I take my lavender oil before I go to sleep. Well, do you know it can be cut with so many toxins that can be destroying you in the inside, getting through your skin. Those plugins are definitely not a way to go. The air fresheners, deodorants, all those kind of things, they're just so toxic, and those chemicals are overburdening the body. And that's why people become autoimmune, because their body can't even differentiate anymore, just starts attacking everything.
Absolutely. So speaking of skincare, are there certain things that they can look for or maybe just start with as far as avoiding and looking for on a label from their deodorant to even nail polish? I just recently changed my nail polish because I know that this is a sensitive area, meaning, can't we absorb a lot of things through our nails?
We have a lot of capillaries, right? In our nail beds and around there. So when people are getting manicures and pedicures and they're slipping away, you have to really think about all those little chemicals. So what are things to look for? Basically, you really, just because it says organic or natural, Trust me, I've seen a lot of those kind of things. I do a lot of aesthetics in my practice now, so I carry a lot of high-end, skincare.
Sure.
But I also make sure they don't have things like parabens, phthalates, sulfates, any ingredient in food or skincare that you cannot pronounce.
Right.
It's not real. It's made and synthesized in a lab. You want to be able to get things that literally smell like fruits and vegetables, that really have just a few ingredients that are basic, that we find in nature, whether it's food or skincare. That's
similar to what we look for in a food product.
Right. Paint, when someone's painting their house or doing renovations, you look at those kind of the contents with how much the volatile, solvents that they're in there. They have those kind of things. They grade it that way because inhalation is a big way to go. So occupational exposure is huge too. People who are hairstylists, they work in hair salons.
Oh my gosh.
People who work in factories, they're maybe manufacturing something or in an assembly line. Masks, wearing protective gear. I mean, anything you touch or smell is going to get to the body real quickly.
So it's like if you're allowing your body to be in this environment on a daily basis, that's when it's the most important. You're exposed to all of these toxins and chemicals. That's what's going to impact you. But if it's occasionally where you're getting your nails done or things like that, I mean, they shouldn't have to worry about that, right?
No.
It's what you're daily living.
It's a cumulative effect, right? Every now and then we're going to have to be in those environments.
Okay.
But you look at your occupation, look at like your childhood, did you have, with your dental work, did you have a lot of mercury fillings, right? Or did you live in a very old house that maybe had lead paint? I was born in New York and raised in Jersey, and I remember basements were such a big thing. And my mom, during the summertime, used to let us go and take naps in the basement because it was so cool down there, right? Because it's a basement. You're not really getting... You're underground. And then, later on in life, I would read about all the radon and all those, I don't know. And for years, you do that as a child. You don't think about that.
Absolutely.
So,
So your child could really...
It's your foundation. Everything that you're exposed to, even in utero, I always talk to my patients. And they're like, oh my God, Dr. Verma, I've never had anybody ask me questions about my mom's pregnancy with me. Like if she took medications, or was I born by a C-section? Was I breastfed versus not? All those things impact our gut health, basically.
Oh, yeah.
And it's, if you're born C-section, you're kind of taken out sterilely, right? So what they're trying to do is, the reason we're born vaginally is we inhale all that flora, right?
All that bacteria.
Now what they're trying to do is they're going to swab,
Yes.
There's just so many things we're more aware of. Breastfeeding.
Right.
Even if you can't do it for the full year or 6 months, just getting a colostrum in the first few days and weeks can impact how your immunity is laid down for the rest of your life.
Oh yeah, that's an entirely different podcast. That's a whole podcast. Yes. Oh my gosh. Okay. All right. So starting with food, then looking at our environment, the things that we put on our skin. What about anything else that we can do on a daily basis as far as helping keep that inflammation controlled?
It's being aware of where your environment, really.
Right.
Okay. So for example, like when you go to a restaurant, and what I've seen is before I get seated at a restaurant, they're spraying the tabletop with Windex, this dirty rag. Do you ever think about that? Laying down your silverware. I have an issue with that, So and
you're so right.
I like to enjoy myself and go out to eat, of course, I use Happy Cow to find those good plant-based and vegetarian restaurants.
I've seen you do that, yeah.
So, but you have to be aware. Okay, so in my house, I don't have any industrial cleaners. All I use is vinegar, baking soda, water. That's what I use to scrub my tub. Okay, I mean, I have toilet cleaner, but that's, I wear a mask when I'm doing that, but I don't have anything. I've asked them not to spray pesticides in the house. They have to just do it in the periphery. In Florida, that's hard because we have so many unique insects.
Right.
That's what I'm saying. Be aware of things that you have in your house first, then go to your workplace. Then when you just go out, it's going to be hard. Okay, if you're staying in a hotel or a friend's place, I mean, bring your own stuff. You don't have to let people know because you don't want people to feel bad. But hand sanitizers, one of the leading causes of hormonal disruption, infertility, cancer, and we douse our kids with these. We hang them on their backpacks. Use organic ones. Go to places like Whole Food, Earth. I have recipes to make your own organic hand sanitizer. I just did, this is a good one, sunscreen. I recently did a Bay News 9 segment where Florida has, in the Senate, there's legislation to basically ban sunscreen that has certain ingredients like octinoxate, homosalate, which are basically so toxic that one drop in 6 Olympic-sized pools is so poisonous to the coral reef system. And we're like putting this on.
Oh yeah, we're bathing in it practically.
1 drop in 6 Olympic-sized pools. So it's getting in the sand. It's not just about ocean biodiversity.
No.
If it's killing the coral reef and the fish, it must be doing something to us.
Oh my gosh.
We're seeing increased rates of cancer, autoimmune. I mean, it's not going to stop anytime soon unless we have that awareness. So
sure.
People might say, well, what's it going to do if it's just, it takes one person, pay it forward. You know, that's what we're doing, right? We're educating the masses, spreading the wealth of health. And if I can make an impact, you know, social media is a great way to do it.
Absolutely.
And I got so hung up in the beginning about, oh my gosh, I only got like 20 likes. It's not about that. People are still seeing it.
Yeah.
I know thousands of people view it.
Yeah.
And the response that I get, it just takes time.
Absolutely.
Pay it forward, you know?
Yeah, absolutely. Okay, so we got, again, reiterating, food, environment, skincare. What about exercise?
Oh my gosh. So I have the 4 pillars of health, which
Yes.
I've developed when I opened my practice.
Pause on that. We talked about that in our previous podcast about
Yes.
reversing the aging process.
Yes.
So make sure you check out that podcast. All right, continue with your 4 pillars.
Very basic.
Yes.
There might be some variations, but I kind of created this, and then as I saw other doctors kind of talking about it, I'm like, wow, this is kind of interesting. All right, clean diet, number 1, exercise, fitness, restorative sleep, and stress reduction, which will, you know, when we talk about hormones, that's going to be an important part.
Yes.
Learning how to manage your stress. Exercise is huge. I think what people think is like, I don't feel good, so how do I have energy to exercise? It is one of the most underutilized antidepressants and anti-anxiety agents. It's almost like you get addicted to it. There's this little meme that says, it's on my rest day, I don't know what to do with myself. Like, it takes more discipline for me to take a day off than to like, that's when you start that cycle, you see the results, right? And that's the whole reason I actually introduced aesthetics into my practice. I'm so used to working from the inside out, but when people don't like the way they look, we have to get up and look at ourselves in the morning, right? Or after the shower, we look in the mirror. So many people are so unhappy with the way they look. They don't have any incentive to want to eat better and do things to work from the inside out. So if you can offer people something where you can tweak them on the outside, you know, doing personal training and fitness, that gives people so much self-confidence and self-esteem.
You can't put a price tag on that. Confidence?
And you have to give it, it's you. Who cares about what other people think? And, it's a whole nother thing too with body types. But when you look at yourself and you like the way you look, then you're going to want to maintain it. You have to do things that are sustainable. Then you're going to be like, well, I'm not going to continue looking like this if I'm eating fast food. That's when people start changing their lifestyle. So those 4 pillars are the key to living well. And it's like you can't drive a car without 4 wheels, right? You have to have it. And at one time, there might be different pressure in the wheels. One thing might be stronger. Then you recognize that. And you're like, okay, wow, I'm not really getting restorative sleep, and see what you can do to mitigate that.
So I want to really hit on, you said do those things that are sustainable. Exercise. Don't overdo it. You'll burn out clearly. 20 minutes daily. Do what's realistic for you.
It's not living in a gym. It's literally 15 to 20 minutes. Put on a YouTube video. There's so many amazing things out there, doing like HIIT exercises, you know, it's a little cardio here and there, weights, cross train, whatever. Find what's best for you. I do a lot of genetic testing, and it actually shows you kind of what body type you have, and if you're more of an endurance person versus someone who's more, you know, prone to developing their body by lifting weights. So there's a lot of genetics behind it too.
Absolutely. All right, I want to finish with stress.
Okay.
And stress and its impact on inflammation. I think so many women really burn the candle at both ends and have no idea what that's doing to them internally. So can you just emphasize the importance of that? Keeping that thing under control?
I don't know. It's like I can overemphasize. Stress is everything. Everything. For men or women, everyone's burning the candle at both ends.
Very true.
The problem with stress is it's very intangible, right? We're used to treating things like cholesterol, blood pressure. We can see it, right? Oh, this is my blood sugar. How do you measure stress, really? I mean, we can get into hormones, but really it's an intangible thing, right? It's by me asking you, so Nina, how stressed are you? And then they'll sit there, they might start crying, you know, and I feel bad, and you know, it's the workplace and stuff. So what I tell them is ways to modify their lifestyle. If you can't leave your job, you know, if you're not looking, you know, it's a family thing, you can't just up and leave, you know, you have to be realistic. What are ways you can modify your lifestyle? It's by taking maybe 15 minutes and doing mindfulness and meditation, you know, that kind of stuff, where you can be just in your own home, go lock yourself in a room, and there's always ways to do it, whether you have kids or no kids, whether you work or not. Just, it's awareness, and it's asking for help. right? Squeaky wheels don't get oiled. You have to like say something to someone. And what I do and encourage people is come, go see a physician. It's confidential. If you're scared to talk to someone, like there's nothing I would ever say without their permission.
Absolutely.
So I see people confide in me, and that's when I really learn their whole story.
Right.
And then I'll work with them and see what are the things that we need to do. What's a step-by-step process, whether it's labs, counseling,
Yeah.
whatever.
Each person is so individualistic, and
there are no cookie cutter.
Exactly. No one size fits all. I think at the end of the day, when in doubt, just breathe.
Yeah, deep breaths are everything. I don't think we ever, I tell people take 5 deep breaths. I'm like, oh my gosh, I never felt that good because there's not enough oxygen. When you're sitting at a traffic light, you can take 5 deep breaths.
And that's free. You can do that any day, anytime.
It's easy.
Really.
It's life-changing.
And that's all, folks.